This is the first talk in a series on trigger points. So, what are trigger points? They are areas in the body that when you press them, they hurt. I mean, you can sometimes feel a rubbery or firm area underneath that feels like a pea. Now, trigger points are one of the most common clinical features related to pain, but they're often one of the most common mismanaged things just because people don't understand why they're there and how they should be treated. Interesting feature about some trigger points is at some point from the time that they emerge, they can actually begin to radiate pain away from where they are in. So if they're in the muscle here, they could make a pain that goes down here. If they're in a muscle here, they could shoot a pain up onto the face. And these are something that tell us this is a trigger point. One, we can actually feel it. Two, it will radiate. Now, not every single trigger point has to, but at some point it may. Why does that happen? Trigger points are essentially myofascial structure. They're myofascial trigger points. And those trigger points are areas in the muscle that are now scarred. It's not just the muscle though. The muscle is held onto the skin and to the body by a glue. The glue is called fascia. Fascia is the largest organ in our body. Now, the nerves and blood vessels travel through that fascia. So if the muscle underneath is in dysfunction, the fascia around it gets deformed also. And when that happens, you can have nerve-like pains or shooting pains that go down the arm. Now, when people get shooting pains in the arm, what they do is they'll go to a doctor, they'll try to get an MRI done, and most of the time those MRIs are negative. Now, for most of our doctors who actually read MRIs, like orthopedics or neurology or neurosurgery, if the MRI is negative, they're not really sure what to do, but it's not a surgical case, so they'll give medications. Those medications block up the pain, but they don't treat the actual cause. It's almost like a stuck garden hose. If you think of a garden hose that sprays water everywhere, if you put a knot inside of it and tie it up, the water that's trying to come out will build up a lot of pressure, and the end behind the knot will become very loose. That's basically what's happened. The muscle in sustained contraction that's preventing nutrients from flowing and makes it dysfunctional.